All right, so if you have not placed your name and campus in the chat, please do so. Remember, this is a new Zoom. As I mentioned before, we took the exam. The last class takes their exam on Friday. So the exam analysis will take place as it has before, and we will post grades Friday evening. Right, presentations are due next week. So we look forward to hearing from you all and seeing all that you have for us. So that's next week. And then week 11 is HESI. So just keep in mind that you should more than likely probably will start receiving notifications from your campus on next week. But remember, it is campus specific. So make sure that you know what you need to know for your specific campus. Don't think about what's going to happen at your campus based on what someone is saying is happening at theirs. So reach out to your campus deans if you have not heard for them for sure by the end of next week. But they should be sending out information because it's week 10 next week. All right, so we are going to start talking about our history information. So just think of, and I did mention going back through all your classroom recordings, your required readings, because remember the history is going to be a compilation of, everything. You never know what's going to be on there. But if you understand the concepts, the nursing process, disease processes, then no matter how you see that patient or if you're asked to delegate something, then you will be able to answer appropriately. So keep in mind that things are specific, they're tailored for the individual client. Remember, it's rarely just one thing wrong with a client. So if they're giving you information in the scenario, the patient, has diabetes, the client also may have anxiety, or they now may have a cold, and something's going on with one of their immediate family members. You want to consider all of those things, unless the question is specifically asking you about the diabetes or the hypertension. But so just think about of everything, because we want to provide that specific individualized care for our clients. So just considering all of those things that's going on with the client will help you to be able to come up with the best answer. And then, of course, to select all applies, just make sure that you're specifically tailoring your answer based on the things that are listed. And no thing is too big or too small. So if the client has had a loss in their family, or the client is newly diagnosed with hypertension or whatever, we want to consider all of that. Think about those key terms, new. And what's those words? I can't, I don't know what is a word for them, but all. Think about that. Make sure you're reading the scenario and make sure that you're specifically answering what it is actually asking you to answer. And remember, an answer choice has to be all the way correct. So sometimes when we see something, we don't read the entirety of it. It's like, oh, but then when we finish reading it, it's like, oh, well, wait a minute, this part makes sense. This part doesn't. It doesn't go. So the entire answer choice has to be correct. So let me pull up our PowerPoint here. So this recording plus the other professors' recordings will be shared. So make sure that you view all of them for your HESI review. And those concepts that you had an issue with, that you still really just need a little bit more understanding about it, start with that one first. Start with that concept first. Of course, we can't get away from the nursing process. And it helps us to think things through. It helps us to not forget anything. So if you have a client that has hypertension, just think about that conversation. What signs and symptoms might that client report that they have been experiencing? What are those things that you might observe when you listen to their blood pressure? What might it be? Normal, abnormal, especially if they're newly diagnosed, or if they're non-compliant. And then what lab tests, what other tests? Just be kind of thinking it through as you go through the nursing process for each of those different disease processes. So we want to use clinical judgment that helps us to take action. So think about those clues and analyze those cues. Think, read, dissect that question. See what each part is actually asking you or is actually about. Is this a child? Is the patient a child? Or are they young adult? Or is this person elderly? Is this person, can they talk? Are they nonverbal? Do we need a translator? So just think about all of those different things, and of course, take your time. Utilize all the time that you can that you have to take these exams. Client needs. We do want to always think about safety. What is in that environment that we want to keep those clients safe? Is it enough lighting? And it's things that we really don't really think about because, we should generally have enough lighting. Generally, things are not in the way that we may trip or fall. Generally, we're washing our hands because we're healthcare professionals. So we're covering our mouth when we're coughing and sneezing. So, but just think about all those things as you consider the client's needs because it's things that they might not have thought about or even be aware of. I think even before COVID, I don't think people really knew what an N95 mask was, but because we're healthcare professionals, we knew what it was. So, but now, so things that may seem simple or you think people know, you they probably don't, because like I said, they're not healthcare professionals. So we want to consider that as we think about their needs. Health promotion. If we can give them information and have tools or interventions out there so that we can prevent a disease process, we want to put that information out there for them to be able to utilize. So nursing concepts, just make sure that think about the professional behaviors. We don't want to be aggressive when we are, taking care of our clients. We want to establish those therapeutic relationships up front. We're not talking about bending the rules or changing, what the policy and procedure is for that client. Just being truthful, being honest with that client and telling them what, how it's supposed to be. Assessment. We talked about, gathering all the information, objective, subjective, what information, if a client usually answers yes to one of our questions that we're asking, then we might need to ask some more focused questions about whatever that is that they're saying yes to. Do you have pain? Yes, I have pain. Well, where is that pain? Well, is it my leg? Which leg? How long has it been there? Is this a new pain? Does it feel the same? Does it limit your mobility? Asking those more focused questions. And with this clinical judgment, going back to, we're providing specific care, unique care, individualized care. Consider the entire client, the culture, their beliefs. Do they have what do they want out of the care that they're receiving? Because a lot of times we can have all these interventions and the client, that's not important to them. So make sure that, and of course, we're going to always use airway, breathing, circulation to decide whether or not this is urgent. And then think about Maslow's hierarchy of needs. The priority of things. Delegation. Usually the tasks and the skills that we're completing as healthcare professionals, you're not delegating those tasks to someone that is unlicensed. Foley catheter, medications, those are things that you would not delegate. So just think about that when you're delegating, having to select tasks and scenarios that you would actually delegate for. So just think about injections, wound care. You've had to learn and gain special skills. You have to be checked off on it. Those are things that we're not going to delegate. Okay. So we talked about being safe. Consider that environment, enough lighting. Is it cold? Is it hot? Is it too warm? Consider safety. Are there any, even steps? The person could have lived, they in their home forever, but because they've had a hip replacement or recent surgery where they're not as mobile. Now those steps become a safety risk for them. So consider the entire scenario, that client, what is all going on with that client. Okay. Again, we're still talking about safety here. Remember your different precautions. We are, PPEs are available all the time, but if you see signs posted for droplet, airborne, then you use those specific precautions, because that is how that bacteria or that virus is being could be transferred. And so by using these precautions, it lessens the chance of that bacteria being transferred. So just make sure that we're adhering to those when we see those signs. We've already talked about hand hygiene, washing your hands, keeping things clean. Client's refusal of care. We want to advocate for the client. We do want to make sure first that they have a understanding and they have all the information that they have questions about, so that that client can make an informed decision before we say they're being compliant. Because it might be that they just have not received enough information, and they may understand the intervention, whatever it is, surgery, a medication, being one thing when it's really not. So we just want to make sure clients have all the information they need so they can make an informed decision. HIPAA, we want to keep things private. Even if you're the nurse in the ER and you transfer a patient up to med-surg, you no longer have a providing care for that client. So we don't need to be looking in that client's chart and doing anything with that client's information, because that client is no longer in our care. We're no longer providing care for that client. So just be careful with that. Even with family members, we want to get permission from the patient that it's okay. It seems like small things, but if it's patient information, we have to it's considered confidential and private. So we need to keep those things private. And so we would ask the client if that information can be shared, or refer who's ever asking to the client so they can get it directly from them. Okay. So medication administration, remember we have those medication administration rights. I think last week we said now it's up to nine medication rights of medication administration. It wasn't that many at first, but now we want to adhere to those things, because that lessens the chance of us making errors. We want to make sure our orders, remember all the components of an order. If they're not matching, then we're not pharmacists. So if it doesn't match what your order says, we're not going to administer that. We want to remember all the interventions we can do to prevent that skin from being torn, broken down, turn and reposition. It seems like simple things, because we're moving all the time, but someone that's sick and not feeling good, they're pretty much just going to be in that same spot. So we have to make sure that they're being turned and repositioned. Then also, how is their nutrition? This person needs assistance with meals, and we need to provide it. Even if we provide the assistance with the meal, then they're not consuming whatever that recommended amount is. Are we offering supplements? Is the meal that we're serving them, is this something this client even likes? Is that why they're not eating? All those things can lead back to a client having good skin integrity, or that skin being at risk for being broken down. It is all very important. Prioritization of care, make sure that the client is stable, even if it's a task that the UAP, the unlicensed personnel, can complete. If the client is unstable, they cannot provide care for that client. We do want to remember the others that are on the healthcare team, because we do want that continuity of care. We don't want gaps in care and or overuse of the client's resources. So we want to make sure that we are collaborating with the others on the healthcare team. For example, I think the example that we gave the other week was the clients coming in, they're in a skilled facility. So they're receiving physical therapy, they're getting wound care, but then they also have to go out for an appointment. We want to coordinate all of those things so that the client can have all of those services provided for them. Because if they're ready to do therapy and the client is out to a doctor's appointment, they're not going to get the wound care or the therapy. So every session does matter with that client getting back to their best level of care, best level back to their norm as close to possible. It all does matter. We got some practice questions coming up. So remember, we're practicing within our scope of practice. Remember, with medication error documentation, we've already talked about that. Okay, legal and ethical. Remember, we are not changing policies and procedures. We're going to abide by, first of all, what our scope of practice says. And facilities, policies, and procedures, they should match. Now, they may vary with, for example, how we take temperatures in a skilled nursing facility, what equipment is available versus what's available at the urgent care. But nevertheless, the way that we take the temperatures is going to be pretty much the same, unless they don't have a thermometer that does, the temporal route or something like that. But all of those things, tasks that they're asking us to complete, make sure it's in our scope of practice. All right, so here we go. We want to identify the question type. What is the questions? What are those topics or concepts that's in this scenario? Then what do you know about it? Even if you have to go back all the way to the body system, like for example, your scenario is about a client that has asthma. Well, what body system is mostly affected? This client has asthma. Oh, okay, the respiratory system. If you have to go all the way back there and identify what organs are in that system and what those organs are supposed to be doing, but if someone has this disease process, what are those organs not doing? What functions is this body system not performing if a person has this disease process? You can go backwards and forward with that. Okay, so assess versus implement. Are we assessing something or are we getting ready to do something? Think about Maslow's, think about those different levels. Okay, spec, here we go. Stable versus unstable. Is this this person potentially at risk for skin breakdown, or is it this client actually has a stage 3 ulcer? Is it real? Potential versus real. Expected or unexpected. A client has been admitted for asthma exacerbation. They're having an asthma attack, and they're presenting with these signs and symptoms. Are these signs and symptoms expected with someone that's having an asthma attack? Or they're not expected. So expected versus unexpected when we're talking about a disease process. And then think about, is this a new onset or has this client had this condition for a while? Okay. No ABCs, airway, breathing, circulation, and then expected outcomes. What is expected once this client gets this care? So other strategies you can use, you can imagine or visualize the client or the scenario as you read the question. Look at the vital signs, the labs. Remember, you've learned normal and abnormals for all of those. So consider time. Is this a new admission from the emergency department or is this client being transferred? Are they, 2 hours post-op or is this 3 or 4 days later? Or is this upon discharge? Because the client's condition should be a little bit different 2 hours after having surgery compared to them getting ready to go home. Okay. Age and growth and development is our client. They give you this scenario, got the parents, the child, and the question is about the child. So consider what would be interventions for that age group. Okay. First doesn't always mean assessment, and actions don't always mean implement. Okay. So we talked about Maslow's hierarchy of needs, looking at those physical needs. They take priority over those psychosocial. Trying to move this little bar up here. Okay. The highest priority is going to be those physiological needs, food, water, shelter. Okay. Another way to think about it. Okay. ABCs, pain, education, well-being, coping, and normal findings. So however best that you understand or your thought process is, these are just all different ways and strategies that you can use to sort through the information and select the best answer. This is another way. Who's going to die first? So when you're talking about priority, is it expected or unexpected what's going on in the scenario? And so if it's not expected, that person's probably going to be the one that's going to, die first. So that's priority. But remember, we're going to take care of all of our patients. But sometimes the question asks, well, who should we take care of first? And they want you to put things in order. Of course, remember in airway, breathing, and circulation, always consider safety. Think about that environment, lighting, heating, fall risk. Are they going to trip up over things? Think about that environment, having that things in reach when they're in their rooms, the bed in the lowest position, call lights in reach. Think safety. Okay. Recognizing expected versus and unexpected behaviors. To prove minimum competency, a beginning nurse must demonstrate ability to make appropriate nursing judgments. You need to be able to recognize both expected and unexpected outcomes. Client comes in to have hypertension, blood pressure sometimes is elevated, sometimes it's close to normal. Then the glucose is 253. Well, hypertension, what does it have to do with their glucose? They don't have a diagnosis of diabetes. Client hasn't just eaten. So what else? That's not an expected outcome when the whole scenario was about the hypertension. So that must mean something else is going on with this client. Okay, outcomes allow the nurse to evaluate whether goals have been met. What is the expected outcome of your action? You administer an antihypertensive. We go back and check that blood pressure, it should be a little bit closer to normal, if not normal. We just administered pain medication. When we go back in to assess that client might not be pain free, but they should express that their pain has lessened. What is the best action for the expected outcome? Will it help or hurt this situation? These are some things that you can ask yourself as you're trying to make the selection about the answer choice. Is it a desired outcome? Is this a accredited answer? And these are just different words. Sometimes different words, resonate with you better. So you just pick whatever verbiage that you like. If I can only do one thing, then leave the room. What would that one thing be that you would do for that client? And what that question is, this little statement here is really was priority. That's really another way of saying it. Okay. Okay. Challenge question. So here you go. In the chat, I'm going to give you a minute and 30 seconds. Let me get my little clock here. Just put it in the chat. 1, 2, 3, or 4. Okay, and start. Give you a minute and 30 seconds. I was kind of late starting my timer here. Okay. So the bladder spasms after draining 1,000 cc's of urine during insertion of the indwelling catheter. This is expected, you know. So, but bladder pain while receiving a continuous saline irrigant 2 hours after a TURP, transurethral prostatic resection. This is unexpected. Okay. So that's expected versus unexpected. So incisional pain on the 3rd day post nephrectomy, requesting a PRN medication for pain. It's expected they probably are going to still be in pain, some pain on the 3rd day. So, but this right here is unexpected. Okay, let's try another one. I got my little clock here ready. Just put in the chat 1, 2, 3, or 4. Uh-oh. Sorry, y'all. I showed you the answer. Maybe you didn't see it. Go ahead. Okay. Two, three, and four are not within the scope of practice for the PN, for the the UAP, I'm sorry, for the unlicensed personnel. Okay, it's not within their scope. Okay. And remember, we talked about active listening, and the one that, for the most part, we are understand, but just remaining silent is the one that we usually have an issue with. So, but remaining silent is therapeutic. It is positive. It is part of active listening. So especially for clients, they're going through something, they just received diagnosis or test results, they just don't want to talk, something that just happened. And but just your presence being there, it's okay to remain silent. They say no, don't want to make a decision at this moment in time. It is okay. So restating, repeating what they said, clarifying, asking those questions, those more focused questions, just to make sure what they're saying, that we understand what they're saying. Reflecting, put it into words, the information you receive from the patient at an effective communication level. Paraphrasing, expressing in your own words, minimum encouraging. It could be the sounds that we're making, and sometimes the hand gestures will encourage the person to keep on talking. Summarizing, stating the main data that we've gathered, and then validate allows the patient to correct information when we've summarized it. Okay. Negative communication. For the most part, we don't have a problem with picking these out, but the giving advice, because the clients, because you've established that therapeutic relationship as a nurse with your patient, then they think, well, hey, let me just nurse what you do. But remember, we make sure that they have enough information to make an informed decision, and we support whatever they decide, but we don't give them any advice. Okay. All right. Another challenge question in the chat. Let me set my timer. Put one, two, three, or four. Okay, let's see. Okay. Obtaining vital signs for a client who takes blood pressure medication. This client, they didn't say this client was unstable. And so they can, unlicensed personnel can measure vital signs. Got it. But they're not assessing wounds, they're not administering medications and taking orders from the doctor. Okay, here we go again. Put it in the chat. One, two, three, or four. Okay. Implementation, the doing. They're emptying the urinary bedside drainage. They're doing something, implementation. Okay. Who do you see first? Remember, expected, unexpected. And what's another? Think about norms and abnorms. In the chat, just type their name: Harry, Naomi, Peter, or Pam. We will see everyone, but this is asking you who will we see first. So who is priority? And start. All right, expected versus unexpected. What's abnormal? What is normal? Okay, here we go. Who are we gonna see first? Okay, bowels are obstructed, so this is probably more than likely. This is expected that things are not moving through; they're blocked. So, even with the Crohn's disease, what happens with this disease process? The person has frequent watery stools. Okay, and they're just 15 years old. So this blood pressure is okay for them. Someone that has liver failure is expected for them to be jaundiced and to have some confusion. Good. Okay. What is or are the most common reasons that the new grad loses his or her license? Failure to notice or recognize. Those assessments, going in and talking to the clients, making sure that you could gather those vital signs, that you are listening to those lung sounds, that you're looking at their legs and feet. Do they have swelling? Is it there? Yes or no? Those things are so important. The client come back and say, well, my legs have been like this for a while. My head has been hurting, all shit. Failure to act or respond. If you're receiving lab results, chest x-ray results, it's not just enough to get that information and just put it in that person's record. What are we supposed to do with that information? Are we giving it to the charge nurse? Someone needs to report that to the healthcare provider. Okay. So, and then that goes to we're not reporting or communicating with also our team, also the healthcare provider. We're failing to act and respond, which means that we're not reporting and communicating. Okay. Think about those principles. Non-malfeasance. We're not going to do any harm for this client. Beneficence is what we're doing. Is this intervention really going to benefit this client? Or is it going to cause more harm to this client or distress? Autonomy. The client is free to choose. We ensure that they have all the information and we support them in whatever decision they make. We want to be true to our clients. If we say that we're coming back in 30 minutes or going to bring back the water pitcher, whatever it is, it may seem like something so simple, but we want to make sure that we're holding through with the things that we're saying that we're going to do. And no matter if the client's insured, uninsured, no insurance, underinsured, a frequent flyer, they're non-compliant, we still provide the same best care for all of our clients. Okay, negligence has those 4 elements. So when you're being that team player and assisting your team, without being asked, you want to do things that will not allow you to assume duty. So we want to do tasks like maybe refreshing their water pitcher, pulling their trash, but we don't want to, take over the care that they're supposed to be providing for their client. Because what happens is then you take responsibility for the duty. So if this client falls and ends up with some type of injury and is related to us not performing our duty, then we have been deemed negligent in providing care for that client. So those four elements: duty, was I assigned this client? And then sometimes during shift, you'll change clients. They may, roll off, someone may get discharged, get transferred. We want to make sure everything is being transferred, that making sure that you have whatever patients that truly are assigned to you, because you have a duty to provide whatever that care plan says. In the event that they have some type of injury and is related to us not following that care plan, it's a proximate cause and we are deemed negligent. All right. Mrs. Stone is recovering from pneumonia and has been receiving steroids and antibiotic therapy. She has an indwelling catheter that was placed 4 days ago. Although being afebrile for 24 hours, she has not had fever. This morning, her temperature is 99.9. What are your concerns? Are there any key words in this scenario? What are 3 things that you can delegate to a nursing assistant and why? Okay. So, receiving steroids and antibiotic therapy. She has an indwelling catheter that was placed 4 days ago. Although being without fever for 24 hours this morning, she's starting to get a fever, 99.9. Okay. Remember, we can delegate walking, which is ambulation, vital signs, bathing, emptying that Foley catheter, repositioning. We can delegate assistance with feeding. We do not delegate assessment, gathering information, having the unlicensed personnel talk to the physician, calling in the lab results, calling in what those blood pressure measurements were. We do not delegate reinforcement of education that has been provided to the client. UAPs are not administering medications and they're not inserting Foley catheters. Okay, what are some areas of education that LPN should reinforce with Mrs. Stone concerning the pneumonia? Okay, what body system mostly is affected with pneumonia? What's not happening? What is pneumonia? What organs? So we want to, respiratory system mostly affected. Those lungs are full of things that are not supposed to be there. So we want to, in that client, more than likely, they're not wanting to cough because it's probably going to hurt them. So, but we do want to encourage them to cough and deep breathe, to take frequent rest breaks because they're going to be tired out because that gas exchange is not happening like it's supposed to. We want to encourage them to use that incentive spirometer. Think about virus transmission. Does this client need of a precaution sign, contact, airborne, and just think about how we can decrease the chances of this virus being spread to others. Take all medication as directed, because a lot of times when people feel better, they stop taking their medications. Encourage them to, Miss Stone, to drink plenty of fluids. That helps move, keeping everything moving and flowing. So remember these tasks when you're being asked to delegate. What is the task or the duty that we're asking this unlicensed personnel to do? Are we asking them to measure vital signs? Are we asking them to insert a Foley catheter? Is it the right circumstance? Stable versus unstable. Is this the correct patient? Are we giving the unlicensed personnel correct directions that's easy to understand? Are we communicating correctly and giving them the information to take to fulfill all the steps to complete that task that we've asked them? And even though we're delegating, we're not alleviated of, it doesn't resolve our duty to still supervise and evaluate what tasks we delegated to the unlicensed personnel. All right. Which of these assessment findings indicate a positive expected response in a 35-year-old client recovering from pneumonia? So it says positive expected. Okay, so I set my timer. Just put in the chat the numbers that is positive and expected from someone that is recovering from pneumonia. So think about those keywords and start. Okay. So it says recovering expected positive. So JBD increases, that's not recovering. That's not a positive. That's not a good thing. You look at it, all these things, the person's getting worse with all the assessment findings that are in black. But the red, this client is getting even the crackles. They still have crackles, but they are decreasing. That means that client is getting better. So those keywords, recovering, positive, think about those. So I'm going to stop sharing here for a moment. It is official end time for class. We have about 10 more slides. So I do have to let you go, but I'm going to still go through the slides. So it will be part of this recording. This recording and also the other professors' recordings will be placed in the announcement section. Take care, and we'll see you next week.
I have a quick question from that last case study that we just did.
Mm-hmm.
Why wouldn't the urine output be also a positive change?
Let's go
Because
back.
if we're encouraging fluids, we would want to see more urine output, meaning that they're drinking more fluids, correct? Or consuming more fluids.
So urine output changes from 42 cc's an hour to 110 cc's an hour. So you are correct. I agree with that one. That is, so we need to make that correction. That is good. So that urine
So it
output
would
is
be
increasing.
okay, so that is a good thing then.
Yes,
Because
that's a good
I
thing.
was like, I got all the other ones, and I was like, when I didn't see the urine output, I'm like, wouldn't we want the urine output to increase? Because if we're encouraging fluids, that they're gonna be increasing their urine output as well.
Exactly. Great. Good catch. We'll make that change.
But
Great.
quick question on that though. I can see that, yes, but wouldn't 110 mLs an hour be excessive?
Well, the average it's based on
It's
weight.
30, right? That's what I'm saying. So 42 is actually okay. So it sounds like the
But
output
if
would have increased a lot.
But think
But
about
if
think
we're
110 is normal,
encouraging
I'm cool with
fluids,
that.
though, we're pushing fluids. So this person is not just drinking normal haphazardly. We're encouraging fluids. So just think about it. If you gulp down a cup of water, you're going to be
No, I
going.
get that. So I'm
Yeah.
saying 110 mLs an hour of urine is okay though.
in this
Yeah.
case, yes, because you're encouraging
Okay.
fluids.
Yes, that's what we're saying.
Okay. I just wanted to make sure that wasn't like a higher amount. That's all.
It is a higher amount. Now, had we not been encouraging fluids,
In
then
like an
that's
excessive fashion.
yeah, that would
Right.
be excessive. Yes.
Right. Okay.
Yeah. Yeah.
Thank you.
You're welcome. All right. So challenge question. A client has been taking antibiotics for 3 days to treat pyelonephritis. Which finding requires the nurse immediate attention? So think about again, which verbiage do you like? Expected, unexpected? Is this something that we should be thinking about is going to happen to this client or not? Airway, breathing, circulation. Think about that. Okay. Fever. Fever is always immediate, requires immediate attention because something's going on. We're fearfully and wonderfully made. It's something when that person has a fever, something's definitely going on. So we said, let's go back to the condition. Pyelonephritis. So something's going on with the urinary. So they're getting antibiotics. These things right here are pretty much expected. This fever is not expected. Even the nausea probably coming from what? Patient taking antibiotics. Antibiotics makes people nauseated a lot of times. So those are expected findings. Okay, so here we go. The nurse reviews the teaching plan in an electronic health record for a client using epotin alpha for end-stage renal disease. The nurse would question which part of the teaching plan. Would we question monitoring iron and hematocrit levels on a regular basis? Would we question avoid large crowds and fresh fruits and vegetables? Would we question monitoring the blood pressure? Or would we question call 911 with chest pain or shortness of breath? Okay. Epotin alpha increases red blood cell production and allows for higher quality of life and increased dose and duration of chemotherapy. Treatment is not without serious side effects, including heart attacks or thromboembolic disease. Clients' blood pressures and hematocrit, in addition to iron levels, they do need to be monitored. The medication is given sub-Q, not orally. Activity restrictions and protective isolations are not indicated. So just think about, well, would we be doing this for this client? Is this an expected intervention for what's going on with this client or not? Okay. So we have a nurse. They are assigned to perform assessments on 2 patients with diabetes. Assessments reveal all of these findings. Which finding would the RN instruct the LPN to report immediately? So if we're having to report something immediately, something's not right. This is not an expected outcome. Okay. Report immediately. Finger stick glucose of 185, numbness and tingling in both feet. So we have 2 patients that have diabetes. And as you're reading to the answer choices, sometimes you want to go back to the questions, like, and refocus. What is this question about? Patients with diabetes. And I'm needing to find something, signs and symptoms that needs to be reported immediately. 185 is kind of high, but it's not something that probably needs to be reported immediately because they have diabetes, right? That's probably why that's an expected finding. Glucose's hemoglobin A1Cs are going to probably be out of range. But like I said, this is high, but not too high. Numbness and tingling in both feet. They have diabetes. Profuse perspiration. What is that all about? A bunion on the left great toe. Clients have diabetes. Which of these should I report immediately? And the answer is the profuse perspiration. More than likely, that sugar has dropped. And so that may be a complication of them receiving their, they've been newly diagnosed. So body's adjusting to them getting these medications, and sometimes they'll drop. Especially if they don't have that nice balance between food, medication, and their activity level. And so that profuse perspiration is a symptom of hypoglycemia. Okay. So delegation, remember those delegation rights. All of the following nursing care activities are included in the care plan for a 78-year-old man with Parkinson's disease. What happens when someone has Parkinson's? What are those signs and symptoms? Okay. Who has been referred to the home health agency? Which activities will the LPN delegate to unlicensed personnel? Okay. So we're delegating tasks. What can the unlicensed personnel complete? Would they be doing tasks, implementing tasks that I'm supposed to complete? Okay. All right, now let's see. It says which activities can be delegated. Select all that apply. Measuring the pulse and blood pressure, assessing improvement in the tremors after receiving the levodopa, reminding the client to allow adequate time between meals, monitor for signs of toxic reactions to anti-Parkinson medication, assisting the client with prescribed strengthening exercises. All that apply for unlicensed personnel. Okay. They can measure the blood pressure measurements. They're reminding them to allow adequate time between meals, and they can assist with those strengthening exercises. Okay. But they're not anything they have to use judgment for. See, right here is already written down, and usually with the physical therapies or either the physical therapy aides, what they do, especially when they're getting ready to, that patient's getting ready to roll off their therapy, they'll bring all the staff in and say, hey, this is what we're recommending to keep this client as mobile as they can be. And so these are things that they prescribe for us to be able to do with the client. Range of motion, active assistance, walking 3 times a day, whatever that information is. But that is something that they can do. Okay. A 23-year-old client with a history of encephalitis is admitted to the medical unit with new onset generalized tonic-clonic seizures. Okay. Have a history of encephalitis, new onset. Which nursing activities included in the client's care would be best to assign to LPN whom the nurse is supervising? Okay. So this is a nurse, LPN. Okay. Observing and documenting the onset of the duration of any seizure activity, administering medication, teaching the client about the need for frequent toothbrushing and flossing, developing a discharge plan, assessing for adverse effects of this new medication, and then turning the client to his or her side to avoid aspiration. So which activities included in the client's care will be best to assign to an LPN? Okay, what's in our scope of practice? Okay, any nursing staff member who is involved in caring for a client should observe for the onset and duration of seizures. Okay, although a more detailed assessment of seizure activity should be done by the registered nurse. Everybody's looking out for this client to see if they actually observe this client if they're having seizures. Administration of medications is included in the LPN education scope of practice. Turn the client on his or her side to avoid aspiration is within the scope of practice of the LPN. Teaching, discharge planning, and assessment for adverse effects of new medications are activities that require the RN scope of practice. We can reinforce what's already been taught or reinforce those discharge plans, but we're not doing the initial. Okay. I'll give you a few minutes to read this question. So read it as the examples that I gave you as I was reading the other. Here we go. Okay. Administration of nitroglycerin and appropriate client monitoring for therapeutic and adverse effects are included in the LPN education scope of practice. Collecting a blood pressure, pulse, and oxygen saturation should be delegated to the UAP. Client teaching requires RN level education and scope of practice. Okay. Those keywords: teaching, reinforce teaching. Okay. Here we go. Here's another one. A client whose systolic blood pressure is always higher than 140 millimeters of mercury in the clinic tells the LPN, my blood pressure at home is always fine. What action should the nurse take next? Okay. Ask the client to obtain blood pressures twice a day. The American Heart Association recommends, and we know that white coat syndrome, and it is true. Some people's blood pressure automatically goes up just because they come to the doctor's office. But if we're having that client to do those blood pressure measurements while they're at home, keep that log, and then we can reassess and see, well, hey, is this really a problem for this client or not? Okay, for a patient with hypothyroidism, which task should the nurse delegate to an experienced, unlicensed personnel? So we're delegating to unlicensed personnel. Okay, monitoring vital signs and recording their values are within the education and scope of the unlicensed personnel. We're not asking them to draw blood. We're not asking them to teach or to instruct. Okay, look for those keywords. All right. So all of the PESI reviews links will be provided for you. Please make sure that you go back through your required readings from week 1 and your classroom recordings as well. Happy learning.